Welcome, everyone. Today we have with us the Southern Ohio Community Care Transitions team to discuss how they have established feedback loops with their hospital partners. And we are joined by Carolyn Ditchendorf and Beth Acree, both with the Southern Ohio team. Carolyn is a former hospital coach and is now the program manager for the Southern Ohio team, and Beth is the hospital champion with the Memorial Health System. And before I turn it over to them, I just want to point out their team's scorecard, and you can see that their close, deep partnerships have helped them achieve an enrollment of 350 CCP enrollees per month, as well as a 19.6% reduction in the all-cause fee-for-service readmission rate. So I want to start out, Carolyn, by asking you a question. We've heard about the really great feedback loops that your team has worked to establish, and I'm wondering if you could sort of walk us through that process from start to finish so that we can sort of see how that works and how that process works between your team and the hospital.
Thanks, Chris. Okay, so one of the things we started to notice early on when we were starting the Care Transitions program with our partner hospitals was our coaches who were out in the community doing the home visits were starting to uncover maybe trends or issues that they would discover in a home visit or a SNF visit, and we wanted to develop a way to get this information back to our hospital partners. Because one of the key things learned with the Transitions program is that you have to be able to communicate clearly, and that is part of the solution to solving some of these problems, whether they're avoidable readmissions or whatever. But one of the first reports that we started to develop was a concerns and issues report. So when our community coaches are out in the home or the SNF and they uncover an issue, there is a template that they use for their home visits, and in that template is a place to indicate any concerns or issues. And once these are identified and their documentation is done, they forward these reports, these templates, to their supervisor, and their supervisor then forwards them to the hospital partner champion. And be once a month, or that can be as identified, kind of depends on what the issue is. Anything else, Chris?
That's excellent. And Beth, can you talk a little bit about, from your end, how the hospital and you and your staff respond and react to the back?
We totally agree with Carolyn's concept. Communication is definitely key. You can never over-communicate as a hospital partner. The report, the concerns and issue report, is reviewed by myself, and then I will provide that information to our readmission committee, which is a multidisciplinary committee, including our physician leaders and administrators. And so we use that information to help validate the need to improve in kind of patient access concern, care transition, or patient education. And so we have found that valuable with analysis that we do independently within our system, but also across that continuum out into the community. So this has proved to be a very helpful analysis.
Thanks, Beth. And can you all provide a few examples of how this really works in your program and how you've been able to produce actionable changes to your program as a result of the feedback loops?
Next slide, please. So one of the things that we were finding out early on in our program and our relationship with our hospital is that our patients were lacking access to PCPs. The hospital had set up a physician referral line, and they were feeling like that just been helping to deal with the issue. And we were finding out that maybe they weren't getting phone calls back in a timely manner. They were readmitting to an emergency room to get their prescriptions refilled. There was just some lack of continuity there.
So, Chris, with our hospital information from our referral line, and then with Carolyn's concerns and issue report, our hospital worked to develop a Care Connection clinic. And these are patients that are of high risk. They do not have a primary care. If we can't place them with a primary care within a very reasonable time, they will start primary care physicians in this clinic until they're stabilized and can be placed with a physician that meets their needs.
Okay, and then another thing that we were finding out feedback-wise through these issues and concerns reports were that patients were being readmitted because it was a lot of information they were getting at discharge. It was overwhelming, and they were having a hard time understanding how to manage their diseases.
Our hospital worked to develop patient disease management education materials that was easily understood by our patients, and we implemented that not only within our health system but across our continuum with our post-acute providers, home health, our skilled nursing facilities. The care transition coaches use that information, and so we found that to help reduce some of that educational clutter, if you will, for the patients. So they're looking at one type of education, and it's consistent across that continuum.
Right. And then another issue that we were running into early on was that we would notice that patients sometimes might receive incorrect medications, or it wasn't a complete reconciliation. And we know that medication reconciliation is never going to be 100%, but our partner hospitals were able to provide some assistance with that too for our coaches.
Our hospital pharmacist was available to the home coaches. They had our number. Of course, we have pharmacists on staff 24 hours a day, and so the home coach can call into the pharmacist, discuss that patient's medication list, and if there's any changes from our formulary back to the patient's bottles at home, they can work through some of those concerns and hopefully resolve them and avoid a readmission.
And so
I would say that these are excellent examples.
That is the benefit of the DEEP partnership. From day one, our hospital partner, Marietta Memorial, has been such a good support to us and welcomed us with open arms. Like our staff will say that we feel like we're part of Memorial Health System. That's how enmeshed we are with them. So that it was logical to get involved with these feedback loops, because otherwise, how are we even going to be remotely able to solve any of these? It's pretty consistent among all 5 of our partners.
Really seen some great success from implementing the feedback loop process. So thank you for sharing more about it and sharing your success. And Carolyn, I'm wondering if you can talk also a little bit about what your next steps are and how you've continued to refine this process.
Sure. So our next steps are we have continued to do our concerns and issues report. That's one report that we send out to our partners. But what we're really focused on now is our readmission report and refining that process and looking at root cause analysis and avoidable versus unavoidable. So we are in the whole big mix of this right now. And it's very exciting because we're working through it at a quicker speed now, because we've been doing this whole transition project now for almost 4 years. So, we implement things pretty quick. Our coaches on board pretty quick. Our partners give us feedback, and we adjust and refine as we need to. So we're going to keep doing it. Communication is really what it's all about, and keeping it simple for your coaches so they can focus on the patient and making that feedback loop simple well.
Great. Thank you both. You've clearly demonstrated that the feedback loop process is very simple and straightforward to implement, but yet can have very far-reaching results and significantly improve a care transitions program. So you both for talking a little bit about how your process works, and thank you everyone else for listening today.